Welcome back, my dear students. Today we are going to explore ischemic heart disease or IHD, also known as coronary artery disease. It's a condition where the heart muscle doesn't get enough blood and oxygen because the arteries supplying the heart become narrow or blocked. This happens mainly due to atherosclerosis. In our previous class, in yesterday's class, we have described about it, how fatty plaque clogging the coronary arteries, just like rust or dirt clogging a water pipe. When the blood flow is reduced, the heart struggles to meet its oxygen demand, especially during exercise or stress. This shortage of oxygen can lead to angina or chest pain, heart attacks, or even heart failure if the damage continues. In this class, we will break down why IHD or ischemic heart disease develops, how plaques and clot block blood supply, the warning signs like angina, and how lifestyle, medicines, and surgeries can help manage it. Let's make the concept of IHD clear, simple, and easy to remember, so that you can easily connect it with real life health awareness. Ischemic heart disease, IHD, or coronary artery disease, CAD. What is it? Ischemic heart disease means that blood supply to the heart muscle is reduced or blocked. This happens because the coronary arteries, the blood vessels that feed the heart, become narrow or blocked. The main culprit is atherosclerosis, deposition of fatty cholesterol plaques inside the arteries, and it results the heart doesn't get enough oxygen, mismatch between the oxygen supply and oxygen demand of the heart. So we need to know how does IHD or ischemic heart disease develop. Step by step process. Atherosclerosis begins. Risk factors like high cholesterol, smoking, high blood pressure, diabetes damage the inner lining of the arteries. Blood cholesterol or LDL enters the wall, gets oxidized, attracts immune cells like macrophages. Foam cells then form fatty streaks, slowly turn into a plaque like dirt clogging in a pipe. Narrowing of the arteries. As plaque grows, the artery becomes narrow. Less blood reaches the heart muscle, especially during exercise or stress, when the heart needs more oxygen. This causes angina pectoris or chest pain. Plaque rupture and clot formation. If the plaque breaks open, blood clot or thrombus forms on it. This can suddenly block the artery completely. It results heart attack or acute myocardial infarction. Prolonged lack of blood supply, short ischemia, which is reversible, can cause angina or warning sign. Long, severe ischemia can cause irreversible damage or myocardial infarction, heart muscle death. Chronic ischemia, it can cause fibrosis or scarring, or it can cause heart failure, which is ischemic cardiomyopathy. Risk factors of IHD. The risk factors can be modifiable, which you can control them. High LDL, which is bad cholesterol, or low HDL, which is good cholesterol. High blood pressure, hypertension, diabetes or insulin resistance, smoking and excess alcohol. Obesity, lack of exercise, junk food diet like saturated fats, trans fat, refined carbs, etc., and stress. Non-modifiable, you cannot change them, like age. Older age causes higher risk of heart disease. Sex is men more prone. Women's after menopause. Genetics or family history, strong risk if relatives had early CAD. Pathophysiology, in short, easy flow, endothelial injury due to risk factors, LDL cholesterol then enters the vessel wall and it gets oxidized, then macrophage and foam cells form the fatty streak, plaque forms with the help of fibrous cap and lipid core, the narrowing of the blood vessel and reduction of the blood flow to the heart, then oxygen supply will be less comparison to the oxygen demand in the heart. On exertion, stable angina occurs, then plaque rupture and forms clot, which is from the unstable angina or heart attack. Prolonged ischemia causes necrosis and scar, which transform into heart failure. Management of ischemic heart disease, lifestyle changes are which is the cornerstone. Quit smoking and alcohol. Eat heart healthy food like fruits, veggies, whole grains, less oil and fried food. Exercise regularly like walking, cycling, swimming. Control weight and manage stress like yoga, meditation. Medicines, antiplatelets like aspirin or clopidogrel which prevent clots. Statin, atorvastatin or rosuvastatin which lower cholesterol and stabilize plaques. Beta blockers which reduces heart's oxygen demand. ACE inhibitors or ARBs control BP and protect heart. Nitrates which relieves angina or chest pain. Calcium channel blockers which relax blood vessels. Anticoagulants which are used in acute heart attack. Procedures or surgery. PCI, angioplasty plus stent, open blocked artery with balloon and stent. CABG or bypass surgery, new pathway made for blood to bypass blocked arteries. We know in today's class we understood that ischemic heart disease happens when blocked coronary arteries reduce oxygen supply to the heart. It can cause angina or chest pain, heart attack or heart failure. The main cause is the atherosclerosis worsened by risk factors like smoking, high cholesterol, diabetes and stress. The good news is, with healthy lifestyle, medicines, and timely treatment, ischemic heart disease can be prevented and managed. Protect your heart, protect your life. Stay consistent, stay healthy, and keep learning. See you in the next class. Thank you.